Biomarker testing is going to be part of just about any area that you practice in at this point. So I think it's really important to understand the basis of it so that as a nurse, you will be able to use that information.
I'm very lucky because I'm at an academic medical center. So generally, I'm not the person who orders it. I do participate in that process, but generally, our nurse coordinator, our medical assistant will be the ones who order that. And they've become quite expert at it, actually, because it is just a routine part of our process now.
The physicians here ultimately decide what therapy the patient is going to get, but I then, go back and educate them of why we're going to choose this therapy and what it's going to mean for them.
Not only is it not going away, it's always been with us. We've just called them different things. We've always been on this quest to find out more and more about the nature of specific cancers in order to treat them.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. And today we are joined by ONS members Kristen Daly and Jessica Four to discuss biomarker testing and how nurse practitioners working in academic and community settings can communicate testing results to their patients. AstraZeneca sponsored this podcast episode, which is brought to you by ONS. First, we have Kristen Daly, medical oncology nurse practitioner at the Siteman Cancer Center at the Washington University School of Medicine in St. Louis, Missouri, and member of the St. Louis ONS chapter. Thanks for joining us today, Kristen.
Thank you very much for having me.
So let's start out with some background on biomarker testing. What is it and how is it used to guide patient care?
I think biomarker is a very broad term for good reason. The problem with that is that it sounds a little too broad and people aren't quite sure what it is. The way I usually explain it is that biomarker testing is something that we can test for that is specific to a patient's cancer and gives us information that helps us refine their treatment, make it specific to their cancer so that their treatment is more effective and targeted. A couple of other things is I think most nurses actually already know what biomarkers are. They just know them by different names. So, tumor markers are biomarkers. Biomarkers are genes, proteins, or other substances that give us information. Every single patient who has cancer has a unique pattern of these biomarkers. So, for example, in breast cancer, we've known about HER2 testing, ER/PR testing. People may not think about those as biomarkers, but they are. I also sort of want to make the point that today we're talking about somatic biomarkers. In other words, things that are unique to the patient's cancer, to the tumor, not germline biomarkers, which are something that are inheritable changes. I just wanted to maybe talk about a couple of different kinds that you might hear. So a diagnostic biomarker does just that, helps us make a diagnosis. But we also have things like monitoring biomarkers. We have prognostic ones, predictive. And so it's not just sometimes a single test. And that's why it's sort of a broad term, but it's information, right? Information specific to the patient in front of us that helps us treat them better.
Well, thank you for that. I think you bring up so many good points just about the different types of biomarker testing and how nurses probably have been exposed to that, but how it's so important to really understand what they are and what they're used for. So I want to switch gears a little bit and talk about your background. Can you tell us about your specialty area and practice setting?
Sure. Well, I've always been an oncology nurse. I started as an oncology nurse in GYN oncology and then became a nurse educator in oncology. And now I am a nurse practitioner in head and neck cancer. And that's the vast, vast majority of patients that I see in medical oncology. And so I manage patients with head and neck cancer in both the curative and the palliative setting. And head and neck cancer covers mostly squamous cell carcinoma of the head and neck, but also things like metastatic thyroid, salivary gland cancers, and nasopharyngeal carcinomas.
Okay. So, what is the history of biomarker testing in your particular specialty area?
So, a couple of things that are sort of so in nasopharyngeal cancer, EBV testing has always sort of been very important to determine which kind of treatment. In salivary gland cancer, it's important to test for androgen receptor positivity because that can determine certain kinds of treatments. But the main change over the last 10 years, really, in head and neck cancer has been in head and neck cancer of the oropharynx, which is really the majority of cancers that we see, and doing P16 testing. Now, P16 is a tumor suppressor gene, and it is overexpressed in people who have HPV, human papillomavirus, related cancer of the head and neck. Now, P16 is not HPV testing, but it is a good proxy as a test for that. If someone's on a clinical trial or if you need to test for it for another reason, we can do HPV testing by IHC, immunohistochemistry. Now, patients who have P16 positive or HPV related head and neck cancer, squamous cell carcinoma, have a much better prognosis than people who are P16 negative. Now, before this was known, they sort of treated everybody and couldn't sort of figure out why some patients seem to do so much better. And now we know it's because they almost behave like two distinct kinds of cancer. HPV related is more virally driven, and P16 negative is generally, not always, but generally related to other exposures and smoking. So really, actually, in the staging system for oropharyngeal cancer, it's actually there are two staging systems according to whether you're P16 positive or negative in this group of head and neck cancer patients. So that's how important a change it has been. And it really does change how we are treating patients, particularly in the palliative setting. But increasingly, we're seeing more and more clinical trials. I think it's going to be changing how we treat these patients, even in the curative setting going forward.
So, you can really see how instituting biomarker testing or the advances in biomarker testing have definitely changed the way that you treat the patients that you see in head and neck cancer and the outcomes that you're seeing from those from those treatments.
Absolutely. Patients are often surprised by that. But, that's one of the things we do share with patients if they have a P16 positive, that's a prognostic biomarker as well, that they have a much better prognosis with standard treatments. It's usually about a 90% cure rate.
That's amazing, especially for patients with diagnosis that in the past it was kind of, you just treated everybody the same. But now you can, hone in on that so much better. So, talk about your role in biomarker testing with the patients in your practice.
Sure. So while the biomarker results are generally shared with patients by our physician as part of sort of the process of determining what their treatment plan is going to be, I do a lot of the additional education. I hear, can you please tell me what he just said in plain English a lot? And you really have to know the patient and know how much the patient wants to know and have to be careful to avoid medical jargon. And I really try to emphasize is that this gives us information about your specific cancer so we can treat you in the best possible way. And that another person who has the same kind of diagnosis may not have the same biomarkers. So even though it's the same site of cancer, et cetera, we're going to treat you differently because we know that this will be a more effective treatment for you.
Let's say you have a patient with a new diagnosis who comes in. Are you the one responsible for ordering those biomarker tests?
So I'm very lucky because I'm at an academic medical center. So generally, I'm not the person who orders it. I do participate in that process, but generally, our nurse coordinator, our medical assistant will be the ones who order that. And they've become quite expert at it, actually, because it is just a routine part of our process now. Sometimes in terms of like billing and fees, we may get our pre-certification people involved. We may occasionally have to do a patient assistance program in order to get people able to get this kind of testing. So I'm very fortunate to have those kinds of resources in social work sometimes, etc. But usually it's just our team itself, our nurse coordinator and our medical assistant, who take care of all of that and then get the results back to my physician and to me.
Does that testing happen at your site, or is that testing sent out and done off-site?
So it depends. There's different kinds. So next generation sequencing, genomic testing would always be sent offsite. But, P16 testing might be done in our pathology department and is routinely done. So, routine tests like PCR, polymerase chain reaction. We mentioned IHC earlier, FISH, which stands for fluorescence in situ hybridization, as well as the next generation sequencing, depending on the kind of cancer and the type of biomarkers that cancer may have, then we would get all the testing necessary. So some of it would definitely be in-house, but for next generation sequencing, that is sent out.
Okay. And then when you get the results back, are they different how you read them and the things that you look for when you get them back from an internal testing versus that, when you do have to send them out?
Sure. I mean, you're really kind of putting the picture together like a mosaic, right? You may have P16 positivity or negativity, and that may come, from our pathology department. And so that may come back more quickly, but you also may have to wait for the next generation sequencing. You may have to wait for an additional test to come back, etc. So, and you kind of put it all together. One of the things that we have found to be very important, both for our team, because remember, other team members are ordering things, and so that everybody has access to it, and also so that insurance can see it, is to document those biomarkers in the patient's chart. So we just have an oncology history section that is included in every one of our notes when we see the patient, so that it's very easy for anyone to sort of go into one of our notes and see if there are actionable biomarkers for that particular patient, just right in the note. And that way the documentation is there so the patient can get what they need in a timely way.
Well, that's really great that you guys documented in that way in an easy location, because I'm sure you guys see it as well. So many patients are transient. They may be in one state for their initial treatment, and then because they don't have family around, they move to a different state to, have more family support, but being able to have that information go with them, so that as things change, and if new, like you mentioned earlier, someone who had testing 5 years ago and now they're in a new state, if that was done and now there's something new to offer them based off of their testing, that information is right there and readily available.
Exactly. And as an academic medical center, we have many people who come from sometimes states away, and they may want to, at different points in their treatment, transition their care. And then we can get that information to their local team. It's very easy to find in our note, but we will also get the actual testing, copies of that to them as well. And that's one of the things with electronic medical records. It's very important. Remember, I just said there's a variety of sources of these biomarkers, internal and external, and they may be in many different places in the electronic medical record. So that's something that I think is important for oncology nurses to think about, where that information is kept and how to get to it at their institutions.
Yep, I agree. I think that's really important that everybody knows where that information is kept and can be found. So, how do you see biomarker testing evolving in the future?
Obviously, it's only going to be increasing. So, I mean, it's so exciting, right? Because we're learning more and more about what might work for a patient. It's always difficult as oncology nurses, when we help treat a patient and they don't respond to a treatment, even a treatment that a lot of people do respond to, and sort of not knowing why that happens. And biomarkers have really given us so much additional information about why some things might work or might not work. And that's just as important for particular groups of patients, even not just which drugs, but sequences of drugs that might be important. Giving things one before the other can be important depending on the patient, etc. Not only is it not going away, it's always been with us. We've just called them different things. We've always been on this quest to find out more and more about the nature of specific cancers in order to treat them, right? And to treat them in a way that gets the cancer. That's our goal. In curative treatment, it's to eradicate the cancer, and in palliative treatment, is to control and shrink it ideally. I think some of the other interesting things, though, is that we're seeing more examples of treatments that are targeted not so much for cancer origin site, but for the mutation. And so NTRK fusions are an example of that, which now has a targeted treatment, larotrectinib. And so anyone who has an NTRK fusion, doesn't matter where their cancer started, what tumor type it is, that we're treating to that biomarker, that NTRK fusion, instead of just to sort of where the cancer originated. And that's a major game changer in the way we sort of think about treatment and what we're doing for our patients.
That is so exciting, I think, just like you explained. And definitely, just how quickly the biomarkers and the new biomarkers that, we're understanding better now, but also, like you just mentioned, with hopefully quicker approvals on treatments that we know are working specifically for that mutation that was found. Well, Kristen, I've really enjoyed our conversation, and you do have a lot of expertise to provide to our listeners. But as we're coming to the end of the conversation that you and I are going to have on this part of the podcast, there are a couple of questions that I like to end my discussions with, kind of quick fire. And so I'm going to ask those to you now. The first one is, what are some common misconceptions about biomarker testing in an academic practice setting?
People don't know that there's support for testing, and that often for particularly next generation testing, and to use those resources. The importance of getting biomarker testing prior to treatment, whether it's curative or palliative. I think we're pretty good at that in an academic setting, but I know just from my experience in sort of talking to people that's not universal. And so it's important at every stage. And it can be very key, actually, in getting the patient the first and right treatment. And that although we in academic medical centers tend to be in our little silos, our areas of treatment, that can be a good thing in terms of specialization. But in that case, you need to really get to know the biomarkers, but also find out about other biomarkers, because as we've discovered, sometimes a biomarker in one cancer, they then discovers a biomarker in another cancer. So maybe not getting too holed up in our treatment area silos, and making sure that we stay educated in general as to what's going on.
Great. Next, what's something about biomarker testing that's not often discussed in academic centers, but you wish people knew more about?
What testing is used by the center? I mean, a lot of times in academic centers, people don't know. That can change too from week to week. That people don't always pay attention. Maybe where you need to send certain kinds of biomarker tests, because there can be specific send out tests. And because we're not as close to it, or we're not as intimately involved sometimes with the ordering or who is doing the ordering, but that's important, as is the cost of it, and knowing about those potential costs for patients, knowing which tests we need to order, and knowing if there are changes. Have we changed a vendor, for example? And that can have major implications for how those tests are read, and sort of what we need to know when we're getting that test, and then going back to the patient with that information.
Okay. Is there additional training or education that oncology nurses working in academic settings need?
Again, learning about the biomarkers that are commonly used in their specific practice areas. They probably see them all the time, but sort of really learning what they are and what the implications of that are. Like P16, positive, negative. What's the implication of that in terms of the treatment for the patient who's in front of you? And those, as we've discussed again, can change quickly, and we can have new ones. staying up to date on practice changes in terms of the treatments, largely related to the biomarkers. Those also change. Sometimes it seems like overnight. Insurance issues or barriers, and sort of being sensitive to that and really trying to connect patients with the resources that they need if that's a barrier to testing. So I think those are some kinds of things that oncology nurses in academic settings need. But I also would have to say that I think that my oncology nursing colleagues here really do that very well.
Okay. And finally, what are some additional resources for patients and providers who want to learn more about biomarker testing?
So I do like the NCI sites. And so cancer.gov has a number of great things about biomarkers and tumor markers. ASCO's site, also cancer.net, has some great information for patients and for providers. ONS obviously always has great information, and the taxonomy is very helpful. If you sort of just look that up on the ONS site, is something that I certainly have used and I have found helpful. And really seeking out opportunities for education, whether that's informally in the clinic and with your team and with your colleagues, or whether that's formally taking a class. If you see a CE class or even something without a CE, that's going to give you information that will inform your practice and care for your patients, I really encourage that. It's a way of keeping your practice fresh as well.
Thank you. Do you have any final comments for us today, Kristen?
I do. I mean, biomarkers, as we've discussed, I mean, it's just something that has such enormous possibilities. And one of the things that I can't help thinking about is, even 10 years ago, we might have two patients with the exact same type of cancer, as far as we knew, right, at that time, who got the same treatment, but had very different outcomes, and that was at times very frustrating and sad for everybody involved, most particularly those patients who maybe didn't do as well. And the fact that we now have biomarkers that can help us differentiate those two patients and give them different treatments for what might on the surface look like the exact same cancer, so that they can both do as well as possible with their treatments. I just think that that's enormously wonderful for patients, as we've said repeatedly, exciting for us, and just gives me great hope.
I agree with you. And it's always good that we have something hopeful and positive to look forward to as we continue to work with our patients and, strive for those better outcomes for them. So, Kristen, I just want to thank you for joining us today.
Thank you so much. It's been an honor.
Now let's move on to Jessica Four, nurse practitioner at Mon Medical Center in Morgantown, West Virginia, and member of the Greater Pittsburgh ONS chapter. Thanks for joining us today, Jessica.
Hi, thank you for having me.
So to start us off, can you tell us about your background and specialty area?
So I initially actually started in critical care nursing, and then I transitioned to a community hospital on the floor as an oncology nurse. Currently, I work in GYN oncology as a nurse practitioner. I've been here for about 10 years, so I've really been here throughout my entire nurse practitioner career.
Okay. So in the specialty area where you work, can you talk a little bit about the history of using biomarkers?
In the last 10 years, we have seen so many exciting changes with biomarker testing and use. We initially, when I started in this practice about 10 years ago, we didn't have a whole lot of target therapies available for ovarian cancer or, endometrial cancer patients. So we began biomarker testing a couple of years really after I started into practice. The first big development that I can remember was back in 2014 when we started testing for BRCA mutations. And we began using those to be able to offer patients PARP inhibitors. So, at this point, that was in 2014. And then we have steadily seen improvements over the last 5, 6, 7 years. We saw the development of PD-1 inhibitors for metastatic cervical cancer, and then that got expanded to the use in endometrial cancer. We've seen VEGF inhibitors for ovarian and cervical cancer development. So really, this is an exciting time for GYN oncology as we've been able to open up a lot of a lot of therapeutic options for these patients.
Yeah, I can definitely remember that there were not a lot of options in this patient population, and just the advancement of testing and how we are able to see what those markers might be specific to their diagnosis and how that has changed things is definitely something that has, like you have mentioned, has just improved the care for these patients in this area of diagnosis. So, can you tell me how you use biomarker testing in your practice?
So initially, when I first started, we hardly used it at all. It was kind of a last resort testing option. We looked at it if we had no other options for chemo. We didn't really know what to use for a particular patient. Now it's at the forefront of our mind, initially at diagnosis. So in some of these patients, we can use it right. We can use certain therapies right away that we wouldn't have been able to use otherwise. So currently, like all ovarian cancer patients get tested at the time of diagnosis for germline and somatic mutations so that we can use that when we are planning their initial therapy as well as their maintenance therapies. So, and we not only do that for ovarian cancer patients, but a lot of times we now have options with certain types of endometrial cancer that we can really use these biomarker testings to hone their therapy.
I think that's just a great thing that, like you said, you can have that testing done at time of diagnosis and then immediately go to a treatment that may not have been offered before or may not have been thought about because you're now looking so specifically at the markers with this particular diagnosis. Can you talk to us about what your role is with the patients in the biomarker testing?
Really, my role is in the education phase. We discuss with them that we are looking for mutations or variants really inside of their tumor that would allow us to use therapies to target their tumor individually. We want them to know that the drugs that we're going to use or may be able to offer them is going to be specific to them. And so, and I most of my role is really with the education part of that and really explaining to them what we're looking for. I guess also at the end of once we have that testing back, I also explain what it means and what options are available to them. The physicians here ultimately decide what therapy the patient is going to get, but I then, go back and educate them of why we're going to choose this therapy and what it's going to mean for them.
I'm sure for your patients, it's so helpful to have someone like you who can sit down with them and explain exactly what that testing means and what that will mean for their course of therapy and potentially for the outcomes with that therapy and what that might look like. Do you see biomarker testing evolving in the future as well?
Absolutely. Right now, we still have upfront therapies that are not specific to certain biomarkers. We still use very general therapies in certain types of cancer. I really see biomarker testing coming into more frontline therapies as we get more research back. At least I hope so, because a lot of times the therapies that we're able to use based on biomarker testing are less toxic, and the patients can really tolerate them for a longer period of time. So I hope that's where the research heads, and I ultimately hope that that's what the research shows is going to be the most beneficial.
It's interesting because, over the past, like you said, 5 to 7 years, things have just been moving so rapidly in cancer care. The new treatment options that are coming out on a regular basis. We have a pharmacology update for ONS Congress every year because there are so many new treatments that are coming out, and it's hard to keep up with all of those treatments. But I think right alongside of that now are these biomarker tests, and how nurses need to understand what that testing is, and also how to explain that testing for our patients and advocate for our patients that they've had the testing done to help improve their outcomes. And I think that we're going to have to really start looking at having that education for nurses so that they recognize what those are, because I think, like you said, it's just coming so quickly.
Absolutely. I mean, if I think back to when I was in nursing school, I don't think the term biomarker was ever even, I don't remember that term ever being a thing. And so I feel like that really needs to be integrated into the initial education of nurses, and especially those that are going to be in oncology. But to be honest, biomarker testing is going to be part of just about any area that you practice in at this point. So I think it's really important to understand the basis of it, so that as a nurse, you will be able to use that information.
I agree with you. And I think it's just going to be so important that, maybe you get a new patient from another location and you have those records that you have to go over, and to be able to recognize and understand what that testing is when you look at those patient records from outside of your institution, because they might not look exactly the same, but being able to identify what markers were tested for and then what that does mean for that patient.
Absolutely.
So, how can nurses, specifically in your specialty area, learn more about biomarker testing?
I think exposure is the biggest thing. Nurses, a lot of times I hear them shy away from looking at the biomarker test, and I would like to see them just delve into it just a little bit more. So the ONS website has such great resources on understanding biomarkers, and the cancer research websites, American Cancer Society, they all have really great information on biomarker testing and what it really means. So I I hope that nurses will take that information and really run with it, because they are ultimately going to be part of the education process for the patients, because they are the ones at the bedside.
Agreed. So, you have given us a lot of information in this short time that we've talked today. And I want to wrap up with some of our quick fire questions that I like to end our podcast on. And the first one I'd like to ask you is, what are some common misconceptions about biomarker testing in the community practice setting?
It's too expensive and it's too difficult. Those are the two things that I hear. We have come leaps and bounds in getting this testing quickly and cost effectively. We use next generation sequencing. It is a very easy process at this point. So I don't want anybody to shy away from it. Just get in there, get your hands dirty. It'll be a much easier process after you do it the first couple of times.
Good to know. I didn't think about that, but that's probably a huge concern for patients in community settings, is what the cost might be of that testing. Next, what's something about biomarker testing that's not often discussed, but you wish people knew more about?
A lot of times you will hear patients want precision therapy or, individualized medicine. Unfortunately, biomarkers don't always tell us that there is something that we can use, and so sometimes it's not going to give us a lot of information. So we still have to rely on our basic cancer care guidelines. So I do want people to understand that biomarker testing is great, and it is going to help us to treat people, to cure people, but unfortunately it's only one piece of a very large cancer care puzzle.
You're right. And I think, like we said, there are so many new biomarkers coming down the pike that we don't know all of it yet. And so we really do have a lot to learn, but we have a lot to that we can build on from what we have already, which is really important and really great. What additional training or education do oncology nurses working in the community setting need?
Really, the oncology nursing certifications and education courses provided by the ONS are outstanding. They That will really equip you to understand the basis of oncology care, and then the rest of what you're going to need you will get based on experience. So both of those, between the book work and the actual patient care, will give you more than enough to really start nursing practice.
Excellent. I think another thing too is for nurses to find someone like you who could be that mentor and really help guide them in learning more and understanding what these biomarkers mean and what they mean for their patients and how to look at them and read them.
Absolutely. You should always find somebody in the practice or a practice nearby who can provide you with additional information or can give you their experience, their insights, and how to make this work for patients.
Excellent. Knowing what your resources are. And speaking of that, what are some additional resources for either patients or providers who want to learn more about biomarker testing?
There is literally information everywhere. Start with the ONS website. Talk to your providers, your nurse practitioners, your PAs. Talk to everybody in your practice setting about how to use this appropriately. There are a lot of continuing education on genetics that you can find online. American Cancer Society has some great resources on their websites as well. It is just as easy as putting biomarker testing into Google, and you will have more resources than you ever thought possible.
Well, that's great. So, Jessica, thank you for that. I appreciate all the information that you've given us and your expertise and how you have been able to speak to those community nurses so that they might not be as nervous about biomarker testing and getting in there and understanding it and finding more out about it as they deal with this with their patients. Do you have any final comments for us today?
Really, I just want to reinforce that nurses are the backbone of cancer care. They are the point person. They are the trusted confidant to our patients. So learn a little bit more about biomarker testing, learn how it's going to impact your individual patients so that you can really be that resource for the patients who you have created this relationship with. It will really help with your career and your job satisfaction. So I hope that this is going to be a really positive change for the future of nursing.
I agree. I think it will. And just that we will be able, as nurses, to continue to feel like we are definitely making an impact on patient outcomes and how our patients are getting through their cancer journey. So, thank you again for being with us today.
Absolutely. Thank you guys for having me.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.